you have any tips that you can give us about how to just take care of yourself, how to maintain, and maybe resources to help you in that effort?
Absolutely. I think the biggest thing people need to remember is be nice to yourself. We are our toughest critic. No one knows our struggles better than we do, but be kind to yourself. Know that your feelings are normal. You're not the only one going through it. And just get through that moment. The next important one, especially with everybody kind of going home and schedules being off, like with COVID and a lot of quarantine, get enough sleep. It's really easy to be on your phone all night long. Your brain needs adequate rest to recharge itself. So if you're depriving yourself of sleep, you're not going to be doing well mentally. A big thing that people talk about all the time is dieting. Like, well, if I dieted, I would feel better. If I lost 20 pounds, I'd feel so much better. But it's really important to eat healthily, but also eat enough. So we see a lot of crash diets that happen a lot, and that tends to lead hand in hand with kind of your mental health going up and down as you make yourself feel bad about that. So realize that your body needs fuel, continue to fuel it. Like it's important. We touched on this a lot, but connecting with loved ones is super important, even if it's only one person. It doesn't have to be family. It could be a friend, it could be a support group, it could be your church pastor, it could be your therapist. Connect with somebody. Take time to relax. We are in a mindset all the time of like, I have to be like on the grind 24/7. Like if I'm not working, I'm being lazy. And that's very, very not true, because your brain works 100% of the time, whether we're actively using it or not. So relax your brain when you're awake, and that's okay. It's okay to take a bath if that relaxes you. It's okay to read. It's okay to take a nap. Like those things are fine. Do things that bring you joy, that are relaxing, that are not stressful. I'll add to that, the things that you do for leisure don't have to make you money. We tend to be like, well, I could turn this into a side hustle. Not everything you like has to be a side hustle. Money is great, but so is mental health. Setting small, realistic goals is the next piece, I would say. People are like, I'm going to, if I'm struggling with depression, my house is not clean, which is a normal thing. Some things tend to slide, and that's perfectly fine. They say, I'm going to clean my entire apartment tonight. Like, I'm going to get to, just ground zero in this apartment. Like, it's going to be clean, and that doesn't happen, and then you feel worse about it. Set small, realistic goals. Do the dishes, take out the trash, maybe pick up your laundry. You don't have to do everything all at once. Just do some small steps right now to help you feel better about it. And then ask for help if you need it, even if it's not professional help. Like maybe I don't need to talk with a therapist right now, but maybe I do need to connect with my doctor. Maybe medication's a good option for me, or maybe I just need to talk to my friend. I've been really stressed out. I haven't really heard from them in a while. Like I just need a fun time. So for yourself, those are some of the main things that I would say.
That's great. That's really helpful. And it's interesting that some of it is like, you've heard this before, eat healthy, eat enough, and get enough sleep, but to maybe not understand how important that is and how much of an effect that can actually have on both your physical and mental health. The KPC article had talked about there being an average in Indiana, one mental health care provider for every 620 people. DeKalb County's was one per every 1,600, which seems like a big difference in need and probably overstressing the providers who are there. What do we do about that?
I think the mentality needs to shift. In Indiana, there's a low priority for mental health, so the government isn't paying as much as maybe other states for getting mental health treatment or rehab services. So just shifting the priority of what we see as important and maybe lobbying for change.
And so are you talking like in insuring or more like grants, community grants, things like that to incentivize, or both?
I think both of them. I think a lot of the time insurance is a big barrier for people. Mm-hmm. Yeah, I think both of them.
This is something though that Bowen Center has kind of put a long-term response to. So a lot of the cost of a mental health facility is a building. And so at Bowen we kind of said we're going to go beyond buildings. So we have counties all the way down to Marion County around Indianapolis that are completely immobile. So these are people that
Oh,
work in the
geez.
field. They don't have an office because we know the need is there, and so we're spreading to meet the need. So we're literally growing faster than what we can even put a building on the ground, because it's not necessarily an expense you need. You need the passionate person who's going to do the work, and all of their work is remote. So we're in 28 counties now, and just spreading through Indiana.
And then during that COVID time, we were still able to reach majority of our patients because we were allowed to do just talking with them over the phone, doing those
Right.
services over the phone. That is slowly going away, but at our center we actually have a mobile therapist that will contact you over the phone to do those sessions still, if it's 100% needed.
Yeah.
And that's a good thing with our skills staff. We go to you. We know transportation is a huge barrier for people as well. So if there's something that they need, whether it's a skills session or getting to a therapy session, like, we're going to be there to help them get there.
I mean, it's no secret that a lot of public service positions and healthcare positions, you're not going to make nearly as much as you would somewhere else doing a different thing. How do you generate that passion? How do you recruit more people who are passionate about this? And what is it for you guys to be in this area?
We've all had things in our lives that have been challenging or difficult, but I think the trick is to turn it into something meaningful where you can actually help others go through that. So for instance, my sister died of suicide 6 years ago, and ever since then, that's been my mission to, if I can stop one suicide or if I can relieve someone's pain, I don't want anybody else to have to go through what my family went through. And so that's kind of my why of what I'm passionate about.
For me, I've always had that passion for helping others. I've always liked seeing people smile and seeing their potential. So if I'm able to make a difference or teach them something that they can carry on for the rest of their lives, and it changes their lives in a positive way, that's the reason why, I'm here in this position and why I do what I do.
And for me, mine kind of goes back to that destigmatizing mental health issues. I've struggled with my own mental health issues my entire life. So it's something that I'm close to, and a lot of things ring really close to home. So helping to teach others how to help people out in the community, I'm really passionate about that, because no one should feel like they're not normal.
Yeah, and to bring it all together, to have the individual difference, the therapeutic difference, and the communal difference, to bring that out, and that's a really beautiful thing. So thank you guys so much for coming in, sharing with us, sharing your perspective with us, sharing your expertise with us, and I hope that this is beneficial to some people in the community, and will be for years to come. So
Yeah, thank you for having us.